Hey Bustmob, it is 4 o'clock on November the 22nd. I'm Dr. Roughton. I work at Amelia Raleigh. This is going live in the Bustmob main group, but you can also, of course, find us on the Amelia Aesthetics Instagram. And if you're not watching this in the Bustmob Facebook group, I would suggest that you join that at bustmob.com. So thank you for submitting your questions in my Facebook post as usual, and we'll just go through them. And also thank you for the recipes because I haven't made any plans at all. I'm hosting, and so a bunch of different family members are bringing stuff, but I feel like I should do something, but I've put it off until the last minute, as I tend to do. Okay, so Hope says, is there a limit on how big the implant can be if you're also having a lift? And the short answer is yes, because when we're adding an implant, we're going to stretch out the breast skin, so that alone can limit blood supply to the nipple. But then also when we do a lift and we're cutting out some of the breast tissue and we're accordioning up the nipple, that's also going to stress the blood supply. So at some point, if you push too much, if you make it too tight or too big or too high, you can have affected blood supply to the nipple. It's rare, but some of it, like, it's obvious. So if you have a big, loose, empty skin sac, for lack of a better word, you'll probably be fine with anything you choose. If you're a borderline lift candidate, maybe who's real thin, maybe he's not had a lot of kids, maybe you don't have that same kind of stretch, then we might have to consider keeping your implant volumes more modest. I can't ever know exactly until I'm in the operating room, and how I explain it to my patients is I put in a deflated saline sizer, so it, forgive the reaching out, but it's like the saline implant, but it has like a little tube on it, and I just blow it up with air until we get to the size that you're hoping for. And if it won't close, if I take my little sterile forceps, my little pinchers, and I try to move everything, if it won't move, I got to take some air out, and then I try to do all those things again until I think it's just right, so to speak. So it's a kind of a Goldilocks, too tight, not tight enough, and then just right. I typically don't change you that much. So if you're expecting 600, you don't wake up with 250. But if you're hoping for 600, you might wake up with 505. It's possible, like whatever. I won't risk the blood supply to the nipple because I know I can always put in a bigger implant in a second stage. Samantha was kind enough to list a pumpkin cheesecake. I've actually made a pumpkin cheesecake before, but that one looks better. Let's see here. Courtney says, do I recommend lymphatic massages? What are some must-haves, nice-to-have items before my surgery? You know, I don't recommend lymphatic massages, but I do think in general massages make people feel better. What I don't want you to do is have a drainless tummy tuck where I have quilted down the skin to the muscles beneath and then have somebody massage that away, because that's preventing you from getting a seroma. So at least for the first 3 or 4 weeks, I don't want you to have a massage there if you're having a drainless tummy tuck. Certainly if you had something like a BBL or just liposuction, it probably wouldn't matter because I don't quilt that down. Nice items to have before or after surgery. The one thing I tell my patients is a straw, because not everybody has a bunch of straws in their house, but you're kind of like half lying back, and it's really nice to be able to take your medicine with a straw, I thought. Oh, yes, and you're the one that talked about butterscotch cinnamon rolls, and I'm hoping you might put that article up there for me. Or article. I'm such a doctor. Put that recipe up there for me. Karen Ann says, how do I decide on high profile versus moderate plus? She's having a revision from moderates, which are too flat and wide. Probably in conjunction with your surgeon. I think it's a little bit, are you keeping the volume the same? Most people don't. Like most people, when they have an exchange, are going up in volume. And so the volume that you have, so a smaller volume, I'd say mod plus, and a higher volume, I'd say high. Hard to know. You can get an implant in there. It's possible at a low volume where it's not wide enough for your body, and so it looks like right now you look flat and wide, but you can also get an implant that's too narrow and looks like a rock in a sock. So it's probably a little bit of a discussion back and forth. I like both and find neither one to be particularly square. Greta's telling me her favorite dish at Thanksgiving is alcohol. So, okay, assuming that you have your alcohol settled down, I'm looking for food choices here. All right, Ashley's telling me a chocolate eclair cake. Kids can help with it? No. We're not involving the kids with more mess making. Oh, and don't forget, you can put your comments in the video too if you're watching. Usually I can see them, not all the time, because I'm like too old. But let's see here. I'm moving on. Angie says, when you're getting a breast lift with a breast augmentation, are there steps I can take to reduce chances of bottoming out? The only thing that I think is, if you're going under the muscle, avoiding like chest workouts and heavy lifting for 6 weeks after surgery. But in general, at least the way I do a breast aug and a breast lift, is I don't violate the fold. It's different. If I'm doing just an implant, I usually use a crease incision underneath. And then, excuse me for itching my nose, crease incision underneath. And then I do go through the fold and then I close it up with suture. So I think that's at more, because my suture could fail a certain percentage of the time, I suppose it will. And then you can get bottoming out. But if I'm doing a lollipop breast lift, I'm going straight through the breast and I'm not going through the fold. So I think it would be awfully hard for you to bottom out. I also think that it's not your fault. Like some things are just going to happen a certain percentage of the time, but it's not like if you do X or Y, you'll never get Z, because then we'd say that all the time. Hang on, I got some here. When can we resume adult activities after breast aug breast lift? When you feel like it. It's probably not for a few days, and then you'll also want to just remember about like chest work. So easy does it. Shelby says, do you recommend a post-op compression bra? I've seen other surgeons not recommend, a tight bra because of blood flow. You know, I think if it mattered, we would have come to a conclusion and a consensus about what was right. But it must not matter because so many surgeons do so many different things and we all get to the same endpoint. So I think a bra sometimes feels good, especially when you're trying to like hold, let me back up a second. When you have surgery, sometimes you get a little pinpoint bleeding after surgery at the incisions. It's normal. I don't want that to get all over your clothes, so it's nice to keep like a little gauze or a little, what we would call an ABD pad or something over those incisions for a day or so to absorb any blood that might leak. I don't really want to have to tape that to your chest. So when you're in like a little bralette, it's nice because it'll just hold that pad on there without having to tape it on your skin. But you certainly don't have to have the pad. It's not doing anything but keeping your clothes clean. I don't think you need a special compression bra. We use a bralette. You can, but I tell my patients if you don't want to wear it, you don't have to. You can wear it, or you can wear a sports bra. I do think we have to be a little bit thoughtful about things that are hard, like an underwire, when you might have an area of numbness. So, because numbness can be a sequelae of any surgery, we just say, hey, let's just not wear any underwire bras for 6 weeks. All right. Becca says, or is it, she says, my surgeon made a mistake, 2 different firmnesses and a cohesive 2 in the UK. Will I be able to tell the difference just over the 2 weeks post-op over the muscle? Probably not, but it would be fascinating if you could. Because, you know, while the implants look different sitting on the table, I have a hard time when they're in the body really being able to tell one from the other as far as how soft they are. So I think it'll be, I mean, I'm sorry this happened to you, and I know it's probably caused an amazing amount of stress, but I'd love to hear and see your result as it develops once the swelling goes away, because we don't have that opportunity to find out about that very much. Let's see. Samantha says, I've been reading about silicone implants being cold in the winter. What's the truth to it? Any way to avoid it? I've never noticed. I've had silicone implants for now 7 years. I've never noticed my boobs were cold in the winter. I don't know if you have to be naked. Like, I'm not sure. But I've heard it before, but it doesn't make a lot of sense to me that they would be, but maybe. Chelsea says, what's best, under or over the muscle? My doctor didn't touch base on that during the consult. So I think it really matters what you want, and I think that if there was one right answer, there would be a consensus. So I think in general, under the muscle is safer because the risk of capsular contracture, scar tissue around the implant, is so very different under the muscles, so 6 to 10 times lower, much lower. So if you're looking at chances that you, individual patient, will need more surgery, under the muscle is better. Now, there are women for whom under the muscle doesn't work. Maybe you have a job delivering Amazon packages and you don't have any vacation time and you have to lift heavy boxes every day, or you can't feed your family. Well, you can't have a restriction like an under the muscle 6 weeks and no heavy lifting, so you need to go over the muscle. Maybe you have seen, like I had a couple come in, and they were married. So they were both women. One had implants under the muscle, and one was getting breast implants. And the one that had implants under the muscle couldn't stand the animation deformity. So meaning like when she flexed like this, the implants moved around and looked weird. And so her wife was like, well, I don't want that. I'm definitely doing over the muscle because I don't, so I think that there are personal decisions that factor in. You hear a lot about like women who do bodybuilding or CrossFit and they don't want to take 6 weeks off, or they're really worried about being weaker. That is a factor as well. So, but in general, let's say you're not an avid weightlifter and you can take 6 weeks off from heavy lifting. I think in general under the muscle is safer, and it's my preference. EJ says, do you need to compress the bra whorl with the Kubi bra? Will the results be affected for Lipo 360? So I don't think so, is the short answer. I think you might get to the end of your swelling faster, but I cannot imagine that it would, like, it's not going to be swollen forever, no matter what you wear or don't wear. So I don't think it'll matter a whole lot, but I know what you're asking me. Okay, we're talking about the winter, certain brand. I don't think I'm not sure that is a thing, the cold in the winter. So I'm going to move on from that one. I see it's in my little list too. Tova says, what do you listen to in the OR when your patient's anesthesia kicks in? Okay, I'm so glad you asked this because it's a scourge. I don't know. I am in the OR a lot and I've listened to everything. And so what we've started doing here is when you fill out like your pre-op preference sheet, I'm asking you what you want to listen to. And I know you're going to be asleep. I don't care. I need some new ideas. Like playlists on Spotify, give them to me. My typical choices when left alone, I like Chris Stapleton, I like yacht rock, I like classic rock, I like older country, I like 90s rap. Like I'm that meme, like the mom in the minivan getting the groceries, like rocking out to gangster rap. It's me. Damn, it feels good to be a gangsta. I love that song. Anyway, I'm dorky, I know it, but I'm looking for ideas. So I don't have it's not like that's my go-to song. I will say I do start every Friday with Ice Cube's Today Was a Good Day. Nobody got killed today in South Central LA, because of course that resonates with me. Okay, Christy says, back to this. Okay, 1 month under the muscle, 280 cc, skin is hanging under one of the breasts. Doctor said he'll give it 2 more months, and if I don't fix it, I need a lift. Can this fix? He wants to do a lift. If not, but I don't want that because I don't want to lose my nipple sensation. I will just have them removed. Is there a way to remove the skin without going near the nipple? Oh, I see. It is a duplicate. A little hard to know without a picture. You probably need a breast lift, is my guess. I would wait longer than 3 months, even though I know that there's this, I feel it too. Like I'm relatively empathetic. So I feel it from you and I feel it from my own patients. Like, hey, I didn't get what I want. Fix it, fix it, fix it, fix it. And I want to, but I've learned. I'm getting older. We need to let it do all it's going to do before we intervene, so that we're not going back and overcorrecting at 3 months and then going back 3 months later and doing this and that. Like you're going to have a complication and we need to leave it alone. So what he's hoping will happen is your implant will drop into that space. Your implant will continue to drop some, so I would continue to wait on that. So don't do anything. Give it a minimum of 9 months before you do anything. And then you're probably going to have a breast lift if you're unhappy with the skin hanging off, because if you don't touch the nipple, hold on. Oh, Okay, sorry. You'd think I'd keep some of these. Now I kicked the stand again. I'm amazing. Okay. Let's see if I can draw this. All right, so you have an implant, and then you have a breast that's hanging off. And maybe this is not the best drawing, but I know you guys you understand. Okay, so can you imagine that what needs to happen is the nipple needs to come up, and we need to get rid of skin in this direction and in that direction, okay? And typically in my hands, that looks like this, and that nipple moves up and that gets shrunk together, okay? If you don't do it like that, hold on, dead air, don't you love that? Okay, hold tight, okay. Let's say you're like, no, I don't want to touch my nipple. I don't like this extra skin, okay? And so maybe you just want to take off the skin at the bottom. It's going to move your nipple down. And so instead of this where we moved your nipple up, it's going to get rid of skin there, and it's going to look worse. It'll be tighter to the implant, but your nipple is going to move down here. That wouldn't look good. So give it time. Let's see how much you can get this to drop, how much this will just come down this way, which will make your nipple look like it's a little bit higher up in there. So, and then I think you just got to be patient. And those scars, I know that they're not, nobody wants them until they have them, and then they will heal. Changes in sensation to the nipple that are permanent are super rare with a breast lift. Like probably 1 in 500 to 1 in 1,000 has a permanently numb nipple. Maybe as many as 1 in 5 have temporary changes in sensation. More common is like zingers or hypersensitivity, and that tends to go away faster. What can happen, and I had some of this too personally, was a little bit of numbness. Like I could feel it, like I could feel touch, but it didn't feel quite as sensitive as it used to, and then that just took a while to come back. Let's see here. Okay, Christy is also saying, hang on, hold on. Also, I'm getting breast messages. I bet it's massages. Yes, that's fine. I think you can massage it, but what you want to do is focus on massaging the implant down, because you're not going to be able to massage the breast up. Okay, here we are. And then Tova was asking me about the tape. The tape is being a pain in the butt. Just take the tape off. I responded in the comments and put some more tape on there. Just wash and dry that skin between, or you can use an alcohol swab or something on it. If there's any little teeny tiny opening, you just want to put a little bit of ointment on it and let it heal moist. Okay. Best sleeping positions after breast lift for best result. You guys are giving me a tongue twister. Do you need to put something in between to sleep on your side? No, I don't think so. I think you can just sleep however you're comfortable. Like if you're laying down, right, you're just pushing the implant more to the center, that should be fine. Several doctors, Suzanne says, have recommended a lift. Several have said I'm borderline, and with a large enough implant I can avoid. I'm wondering if a lift now or in my near future is inevitable, so I should just go ahead. How do I decide? You should probably go ahead and do it. I see you I'm glad you're watching, and I'm getting to your question here. You probably need a breast lift. And I've never been happier with a breast lift. Like I had an implant, I was borderline and I had an implant because I tried to talk my friend into doing my breast lift, and he was like, I'm not doing it. Anyway, I needed a breast lift when I had my implants, and like I liked them better. They looked great in clothes. I didn't have to wear padded bras anymore, but they weren't perky. And now that I have my lift, like they're perky, and I'm so happy with that. It's like now I just wear bralettes. I don't need anything. It's wonderful. And so especially if you're going to get that in the future, like my poor mom, I talk about her all the time. She probably has no idea that her medical history is being spread to the world here, but she's not too far from 70, and she's getting a breast lift like in a few months with my partner. Like, why did we wait so long? Why is she going to get perky boobs at 70? Like, she should have done it 30 years ago. I tried to tell her, but she didn't want the scars. So here we are. Okay. Bree says, how soon after an implant exchange do you generally allow your patients to wear an underwire bra? Probably 6 weeks, but if you're going to like go to a wedding or something and you feel like you really need that extra bit and you want to wear an underwire bra for a few hours, that's fine. Like, we're not the bra police force or anything. Gigi says, is getting a tummy tuck scar revision as limiting or painful as getting a tummy tuck with muscle repair? Or are you able to move better and not be in so much pain? Totally different ball game. It is not that. I've had both. I can answer it. All that muscle work and all that sewing to your fascia is not there. So just stinging at your incision, that's it. You otherwise feel 100% fine. I'm a terrible patient, and I've said that before, but like really I'm bad. Like, I don't listen to instructions, I don't use common sense, and I'm a big whiner about pain. But my best friend was having a birthday party at the local bar studio, and I was like, 3 days post-op. I wouldn't recommend pigeon pose immediately after. That didn't feel good and caused a little bleeding. Don't tell anybody that I did that. You're not supposed to be at bar class 2 or 3 days later, but I felt like I needed to support her, and it was really hard to explain why I couldn't do it. Anyway, long story, but outside of that, you'll feel fine. I'm coming. Heather says, I'm 52 years old, thinking about a breast dog breast lift, 5'9", 180, thinking 470, 550. She's worried that if the implants are too big, would she need another lift within a few years? How long should she expect them to stay lifted? I think they should stay lifted. I think they'll age gracefully with you. I think the most change that we have with our breast is pregnancy and nursing. Puberty, pregnancy and nursing. And so after that, I don't think you're going to have big changes in your breasts. I mean, sure, a decade from when you have them done, they won't be quite as perky as they were immediately, but that's a slow change. Courtney says, I've had pain on my left breast almost immediately after breast dog breast lift. Hurts constantly, painful, sleeping on her sides hurts a lot. It's right in the inside crease as it rounds and underneath the implant. She's 8 months, she's waited it out. She says, taking prescription meds. What would you do? I've got an ultrasound to see if I have a rupture, but it came back good. Could there be a slip? It's probably not your implant that's causing it. It's been there since the surgery. It is probably a nerve. It might be a neuroma, meaning a nerve trapped in scar. Things that would make me think it's a nerve even more so would be the pain would be described as burning, stinging, shooting, electric shocks. What else have people told me? Sometimes itching, etc. Like, it's a little bit hard to know. The other thing you can do is tap on it. This is a really weird thing, but if you tap on a neuroma, if you tap right on that scar, and it may sometimes shoot somewhere, like tap, 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 and then it's like, ooh, almost like on a much smaller scale when you hit your funny bone, because what your funny bone is your ulnar nerve in your elbow, and you can hit it, and then suddenly, like, your fingers are like, ooh. To a much smaller extent than that, that's what that can feel like. That even more confirms that it's a nerve. If it's that, what I'll do for my patients is medication-wise, gabapentin. It's a medicine for nerve pain, works great. I'll also sometimes inject it with local in the office. Like, I'll push your implant out of the way with one hand and inject that spot with the other hand, because for whatever reason, if you can interrupt that pain cycle, it'll oftentimes just get better on its own. And then every once in a while, and this was more when I haven't done it recently, but in the last 5 years, I've gone back to the operating room and cut out that area, because I could inject it, the pain would go away, and then it would come back. So I knew there was, or more likely than not, there was a little nerve trapped in scar. All right, hang on, I got another question here. Chelsea says, ooh, my plastic surgeon is suggesting I have my areolas reconstructed with the breast dog. The cost goes up extremely with and without that procedure. Is that something that's just recommended, or could I tell my plastic surgeon I don't want to do that? I wonder if they mean a donut lift. I wouldn't do a donut lift. A donut lift is where the scar is just around the areola and tries to shrink up the excess skin, but avoids that vertical scar. So like it's a lollipop, but no pop, no line down the front. Tends to cause scar spread at the areola. And it flattens the breast, because if you imagine the breast from the side, you just took the cone off the breast and moved the nipple back. It doesn't. I'm just one person with one opinion. So maybe your plastic surgeon's having great results with that, and there will be women that are satisfied with that procedure, but in general, I'm not, and I don't offer it. I think I would either have implants and not have a lift, or I'd have a vertical lift. I'd have that vertical component, because then it prevents or significantly lowers the chance that you'll have an even bigger areola. Is it okay to massage your sides after lipo 360? Will this hinder anything? It will not hinder anything. You can have massage. Chelsea's saying yes, that was it. Carissa says, I'm 2.5 months post breast aug breast lift, right breast higher and rounder than left, but under the right breast is a fold of skin. Once the right breast drops some more, will it correct? Usually it does. So give this some time. You're still really early, really early. Chelsea says he's going underneath the breast to the implant, but he wants to make my areola smaller. Yeah, he's going to put your implant in through an IMF incision and then do a donut lift, is what I think. So he's going to make an incision here, okay, or maybe not so far to the outside, but here to put the implant in. And then he's going to deepithelialize a circle around your areola and then use these wagon wheel sutures to suture it down. But I'm telling you that you're also adding an implant, right? So it's stretching the breast, so there's already a little bit more tension, and then at the same time, he's going to cinch this down. What does skin do when it's being stretched? It stretches. So it'll stretch. Zoe says, is there some, hello, this is going in hard and fast here. Is there a reason why some people drop faster than others, or do you see a connection with those who drop faster, such as those that opt out of a lift? Oh, yeah, probably, but I don't know that it's ever been studied. My overall gestalt on it is the less elastin, the less elastic your skin is, the more it's kind of given up. So age-related, bunch of kids, massive weight loss, you'll probably drop a little faster because nothing's quite as tight as it was if you're on the other end of that spectrum. So younger, no kids, never lost weight, never been stretched out type of thing. But it's not like 100% and 0%. It's a range. And so while I think you're on the right track, I can't tell any one person how long it'll take them to drop. Amanda says, why are some patients instructed to wear a binder for longer than others? She's been told the worse the muscle separation is, the longer you need to wear the binder. Do you think that's true? No. Also, bras. My plastic surgeon said a good front zip sports bra since I've got no boobs. What's a good bra? Is it tight compression or support holding them up? And why the front zip for so long? The front zip I can answer. That's an easier question to answer, because you can get to it, and this is an awkward move. And getting, like you just had surgery, and getting it down over your head, if you're gonna just a regular sports bra, is uncomfortable. So the front zip is just easier for you to get on and open and close. That's why the front zip. I have no idea what a good bra does, because I have no idea why people say binder for longer than others. It can't possibly matter, is where that's what I believe, but nobody's gonna do that experiment. They're not going to randomize people for different lengths of time to different binders to try to figure out some end point that's hard to follow, because what's the end point? Patient comfort? Well, everybody's different. Circumference? Well, it would depend on your original circumference plus how much was taken off. Like, there's just not a good way to study it, and it wouldn't make anybody any money. So they wouldn't study it, unfortunately, I'm not trying to be so cynical, but it's probably true. We say 6 weeks just because it feels good. We were just going through this because we've had so many people recently tell us how uncomfortable the garment is in that first stage. And I'm literally almost to the point where I'm like, maybe we shouldn't do a garment. Like, maybe we should just do a binder, or maybe the stage 2 garment, which is like Spanx, instead of ever even putting you in the stage 1 garment, because I'm not sure it's doing anything that wouldn't happen on its own. EJ says, I'm 3.5 weeks post-op with my makeover to Amelia and curious if the belly button will stay a slit in appearance and if the torso will stay looking short. You're swollen. So you're just still swollen. I don't think it will, but I don't know you, and I don't know. Sometimes when people have lost a ton of weight, like let's say you're a massive weight loss patient, and so you had laxity left and right as well as up and down, it's more likely to look like a slit because you've still got laxity left and right. So you don't want the surgeon to take out, like you don't want a belly button that's this big, obviously. But otherwise the laxity left and right doesn't allow for the belly button to be very proud. So that may be one reason, but otherwise you're also probably just super swollen still. Torso looking short, I think you're just swollen. We're not changing anybody's torso length because it's bony. Is it normal to feel achy? Oh yeah, you're gonna feel miserable. Everybody's a little different, but I would say at least 6 weeks you won't feel like yourself, not entirely. And then at what week does it change in appearance overall? Well, it's changing all the time, right? And so if you it's just not changing, well, at this point it might even still be changing day by day, but I would say it's probably more week by week at this point. If it gives you some peace, you may want to take like a standardized naked picture of yourself. Like I get out of the shower on Monday and I take a naked picture of myself on my phone so that I can compare them side by side to look at the improvements over time. You might want to do one from the front and then one from the side so you can see that you're getting more narrow in that direction too. All right. Okay, moving on. I got another, skinny baked brie phyllo cups with craisins and walnuts. That sounds good. Crowd pleaser. Okay, Lauren says, I've seen lots of tummy tucks where long torsos end up looking stubby. Are you the same one that just asked me about this? No, it's a different person. I've never even been asked about this before. Okay, will it lengthen in time or does it depend on the placement of the incision? I don't know. Let me see if I can guess what you guys are asking me, because I don't know. I'm certainly not going to change the length of your torso. There's no doubt about it. But I wonder if what you're asking me is, like, if this is your baseline, that belly button's really small. If this is your baseline body, are you guys saying if the scar's here, it makes you look like you're short torso? Let's say you have breast up this way. You look short torso, but if your scar is down here, you look like you have a longer torso? That's possible, but the actual dimensions from like, and I know I'm a great artist and you guys are always impressed with this, but the actual dimensions from like where your arm takes off and where your hip bone is not being changed at all. So I'm not sure. I actually think if you do a breast lift, I will say if you do a breast lift, I think it makes your torso look longer because your boobs aren't hanging over half of your upper abdomen. But and then maybe that's not true. Okay. Bree says, while wearing a wired bra after breast augmentation and exchange help keep them high and perky or prevent them from dropping too low. I don't believe that. Because if it were true, then I would suggest to you that women that wore bras for more of their life would have less saggy boobs than women who didn't wear bras. But that's not what we see. In fact, I think in general, the saggier your breasts are, the more often you wear a bra because you're trying to not have your breasts look saggy all the time, and it certainly doesn't prevent them from being saggy. Okay, Christy, we got to yours already. I'm going to hit refresh and make sure if anybody posted new questions that I got all of those. Let's see here. Are they backwards now? Hold on. Just remember when the guys are doing this and they don't look so dumb, they have help. I think I got all these questions, guys. Okay, friends, have a wonderful holiday. I hope you're all with your families and it is a pleasant experience, or at least not a miserable experience. Don't hesitate to throw a recipe or two my way if you feel sorry for your friendly neighborhood plastic surgeon. And Thank you, Zoe. You have a happy Thanksgiving too. Oh wait, I got one more question from Tanya. How can I tell what size surgical bra to order so I have extra? I don't do that part. It probably tells you to measure. But I will tell you that it's going to be hard to know what size you need because you're putting in implants. So if it were me, I would probably go get a sports bra in like a medium and just know that it may or may not fit all that well. Bye guys. See you next time.